name's Dr. Alan Burke. I'm a facial plastic and reconstructive surgeon. You can find me at knows-about-face.com. Today we're going to talk about facelifting or rightedectomy. This is absolutely the happy business. We're talking about facial rejuvenation. The facelifting, the goal here, I think, should be thought more of in looking better, not so much looking younger. But of course, if you look better, generally people are going to look younger too. I like to marshal our thoughts with facelifts between three categories, starting with working on the skin, then moving to the eyes, and then moving to the face next. To get our very best results, all of these components ideally are maximized or polished up to get the best outcome. Starting with skin, it is well appreciated that healthy skin creates a more healthy appearance. Apart from that, to get the best outcomes, you need to the skin. This is the skin business, so we need a good outer covering with this. For the facelifting business, we can think of tone and texture and elasticity. And to improve these things, generally we're looking at the laser business or light energy stuff. And really we apply the tool to fit the particular need. We're either looking at minimizing irregular pigmentation or blotchiness. We're trying to subtract vascular spider vessels or splotchy vascular flush of rosacea. And of course, to minimize wrinkles. Surgery will only ever redrape skin. So with the wrinkle business, we do need to change the architecture of the skin. We need to wound it in a controlled fashion. And that's best done these days with laser or light treatments. And there are a myriad number of these, which might be summarized best in, or rather the endpoint of which you can choose based on speed of acquisition of endpoint and potential downtime someone's prepared to go through. So next comes eyes. So our eyes, of course, are the windows to our soul. When people ask or question about their candidacy for eye surgery, most frequently they'll say they look tired or perhaps angry. And when eyelid surgery is done well, fitting the face, well balanced to the other anatomy, people say they look energetic, they look interested, they look active, they look present, they look animated. They're all very positive words to use. And of course, they'll look more youthful as part of it. When we look at eyelid surgery for the upper lids, we're really contouring the upper lid with the brow. With the lower lids, we're contouring the lower lid with the cheek or facial anatomy. So these are sculpting procedures. With eyelid surgery, the three main anatomic components will be skin, then the muscle, and then the underlying fat pads and bony structure. So these are the different elements we might manipulate. There is a very important aspect for function with eyelids, so consideration with dry eye problems and maintaining natural functional is critical because eyelid surgery, like so much of facial anatomy, function follows form. So you need to make sure that the normal eyelid function is maintained as part of this process. With regard to other aspects of the eye, volume is an important aspect. Back in the day, our techniques tended to skeletonize orbital or eyelid anatomy, which gave people a hollow or flat tie look. These days, our emphasis is more on volume. The look of youth is a look of volume. So we will augment eyelid procedures with different aspects of filler. We try and preserve fat as best possible. We even consider fat injections at times. So moving to our main event, or the facelift. Again, we're in the happy business here, and we're trying to make someone look better, and by looking better, they'll look more youthful. The facelifts in my book might be divided into 3 categories between mini, the mid-level procedures, and then the deeper plane procedures. There are different levels of sophistication with each. Somewhat simplistically, you might say that the simple facelift procedures are more skin-related, relying more on drawing or stretching out the skin, and the more sophisticated procedures have an emphasis on repositioning facial anatomy or the deeper structures. Ultimately, you pick a procedure and the different nuances between the different categories to fit someone's face and anatomy and objectives. With regard to the face, if we now move to the different levels of the face, with the mid-face and cheeks, we're trying to create a smooth, convex contour from lips across the cheekbone, blending in with the periorbital or eye anatomy. With the jawline, we're trying to create a sharp jawline and minimize jowls. And then with the neck, we're trying to create a sharp cervicomental angle or junction between jaw and neck. And frequently, we're trying to minimize banding or platysmal banding. So those are the different components with it. Again, the facelift procedure is there are multiple different varieties, and these days people will make them somewhat proprietary, which is more of a marketing tool, but the category that's selected or the type of selected should fit the patient's person and objectives. With regard to longevity, we like to say a facelift lasts about 10 years, but of course the aging process continues. If ever I can, I'll emphasize the need for maintenance to try and protect the investment in the facelift so that you can eke out as much as you can from it. I hope this information is useful, and we will continue our facelifting with other more specifics in another talk.